morning.
Good morning.
State your name.
Ayobami Olufadeji.
Spell your name, please.
First name Ayobami. Last name Olu. F as in Frank. Adeji.
And by whom are you employed?
Beth Israel DOC Medical Center.
And what is your position with the Beth Israel DOC?
I am an attending emergency physician.
And doctor, can you explain for the court what is your educational?
Yes, so I completed undergraduate training at the University of Maryland, Baltimore County with a bachelor's in biological science. I then went to Dartmouth College, Dartmouth Medical School, where I completed an MD as a medical physician, and then trained at the Harvard Emergency Medicine Resident Program, which is actually at Beth Israel DOC as well, and completed training there.
And have any board certifications?
Yes, I am board certified by the American Board of Emergency Medicine.
And how long have you worked for the Beth Israel?
I've worked there now for close to 6 years, but I also trained there as a resident, so a total of 9 years.
The witness is scrolling across the bottom of the screen.
What is your current position?
I'm currently still an attending emergency physician at the Beth Israel DOC.
And as an attending physician in the emergency department, what are your duties?
Yeah, so duties there include the practice and care of patients who present to the emergency department. Duties also include the supervision and training of future residents who will go on to be attending physicians. But our work essentially spans all that comes into the emergency department. So treatment of acute illnesses, treatment of trauma cases, and being able to manage and treat in an extensive way.
Drawing your attention back, January 28th of 2020, you were working for the Beth Israel Institute Hospital at that time.
Yes.
And what was your position on January 28th of 2020?
I was an attending physician in the emergency department.
Okay, do you recall what your shift was on that day?
I do not.
At some point on January 28th of 2020, have occasion to treat a patient in the name of Jesus.
I did.
So explain for the court what happened with regards to anti-Sabbath on that evening.
Great. If it's okay, I will look through the clinical documentation that I provided on that day. This case was 5 years ago.
Sure you can.
Thank you.
He's now referring to the medical records and the judge's.
It appears that on that day, the patient had presented in what we call cardiac arrest.
What is cardiac arrest?
Cardiac arrest means that the heart has stopped working.
And what time did you see?
I, per my notes, evaluated the patient at 11. Yes. We began at 11:46 p.m.
And can you just explain for the court what was the condition of Mr. Sabbath when he got there?
The patient was unresponsive. Per records, we had told that his heart had stopped working a few minutes prior to arrival and had been undergoing CPR at the time. But when he presented to the emergency department, he was in cardiac arrest, and so his heart wasn't working, and he was obtunded.
And what did you do as a result of Mr. Sabbath?
So we progressed with what we call advanced cardiac life support, which is a series of procedures and interventions that we take when any patient presents in cardiac arrest.
Which series of procedures? Or on Mr. Sabbath?
Excellent. So per documentation here, we initially began with high quality CPR, which had been ongoing per EMS by the time of arrival. We then continued with the usual protocol, which is checking for pulses every 2 minutes and intervening as is necessary. Over the course of my notes here, it appears that we intervened with epinephrine, we intervened with calcium bicarbonate, other medications as per the protocol. And throughout the course of his time in the emergency department, we unfortunately weren't able to get ROSC, which is return of spontaneous circulation. It is return of spontaneous circulation, meaning his heart we were not able to get his heart to beat back in a standard way.
And the medications that were administered, can you explain those medications?
Yes, so I will start actually with the first one, which is epinephrine, which is a medication that is used to restart the heart, usually in cases of cardiac arrest like this. The other medication there that we give is calcium, which is a cardioprotective medication. Essentially is used when you think that there might be other toxins in the body, and calcium protects the heart muscle itself. Another medication there called bicarbonate is a medication that we give when we think that a patient is in something called acidosis, which is something that can develop after a patient has been in cardiac arrest for a while. And then finally, the other medication that I see here is a medication called amiodarone, which is a medication that we give for arrhythmias.
So what are the resuscitative efforts?
Yeah, so in addition to this, we actually also made attempts to cardioverse him. Cardioversion is a procedure by which we put electrodes on the person's heart and try to restart the electricity of the heart.
Could you repeat the name of that?
It's called cardioversion. Cardioversion, correct.
And what were the results of that?
Through all of this, we were unfortunately unable to obtain ROSC, which I mentioned earlier. And so the way that this procedure happens is when a patient presents, there are certain criteria that you're looking for whenever the patient presents. And one of them is to see if they can actually have what we call an organized rhythm of the heart. We were unable to get this. Many of these medications and many of these interventions were to try and see if we could restart the heart functionally.
Is there anything else that you did to try to?
Yes, so we also intubated the patient as well. One of the many things that we have that happens is we have certain protocols by which we go by to think about what the causes of cardiac arrest could be. One of those is if the patient is hypoxic, which means the patient is not getting enough oxygen. We had been informed that the patient had vomited en route to the emergency department. And so as a result of that, we're concerned about the fact that there could have been vomit in his lungs. And so we intervened by intervening, which is where we put a breathing tube down so that we have oxygen directly into the lungs as opposed to using the nose.
That was performed.
That was performed, correct.
Once he was intubated, what happened?
We intubated him and we continued with CPR.
And what was the result of our after?
The CPR, we were unable to obtain ROSC.
For how long did you continue to work on Mr. Savage?
Per the documentation here, it appears that we worked on him for approximately 40 minutes.
40 minutes?
That's correct.
And at the end of the 40 minutes, what was the ultimate?
A time of death was called.
What was the time of death?
Time of death was 14 minutes past midnight. 0014.
What the time of death is called? What happened?
So right as we are making the time of death situation, we essentially go through a protocol where we make sure that we have covered all the gamut of what we think is necessary in order to intervene. And at that time, we also take a look at the heart with the machine to make sure that there's no rhythm. At that point, that happened. The patient was unresponsive. His heart wasn't beating, and the time of death was called.
And once the time of death is called, what happens to it?
So once the time of death is called, we then have a criteria that we use to determine whether or not a medical examiner should be called into the case. Per the record, Mr. Savage did meet that criteria and the medical examiner was called.
What was the criteria that was met?
So there are a number of different criteria that are used. I'm just going to pull up to here. The one that we had used to decide to call was, just take a look here. I apologize, I did not see that documented, the actual reason for calling the medical examiner.
Oh, interesting.
I've read it, Miss Blair. It was in the records that I read this weekend. So it's in evidence.
The judge did her own homework.
If you have something that you want him to look at, that's fine too.
I don't know, Cynthia, if Andrew Savitz was a friend of Marcy, but if anybody knows that for sure.
By anybody else?
I did not personally, but it is the protocol of our team to usually do so, usually by calling a social worker who then helps to coordinate the care. pleasure.
Simpson?
Hi,
This will be crossed.
good morning.
So would the procedure be that when someone comes into the ER and you begin to attend to them, you and your team, that eventually clothes are removed?
Not in all cases.
You know if they were removed in this
I
case?
do not recall.
Nobody showed up.
And if you do, and I don't know that you will, but do you recognize the name of Nick Giusti?
I do not.
Okay. But there is a procedure and policy at Beth Israel that if clothes or items are removed and someone deceased, is it your understanding that the clothes then are transferred to the police or the Mass State Police, whoever is attending to the death?
I do not know that.
Okay. What is pericardial effusion?
Pericardial effusion is when there is a fluid around the heart. That fluid can be from a number of different things. It could be blood, it could be serous fluid, but yes, that is what a pericardial effusion is.
And do you recall, in fact, you saw no pericardial effusion?
Per my documentation, that is correct.
So there was no fluid around the heart?
Not at the time that we obtained the ultrasound.
And did you administer something like a defibrillator at the ER to try to resuscitate?
That is correct.
How many times did you do that?
For the record here, we attempted defibrillation twice in the emergency department.
Twice. And if you know, from what you observed or what you might recall, you know if a defibrillator had been used on Mr. Savitz before he arrived at Beth Israel?
Yes, per the record that we received from EMS, there had been an attempt to defibrillate him before he got to the emergency department.
Can I approach, Your Honor?
Yes.
That's what I thought too, except
Doctor, I'm going to show you.
it's not the right artery. The Widowmaker. Stephanie, that's what I thought.
I do not recall. I do see red markings on what appears to be the left side of the chest. Not necessarily.
I can't hear the
It could be,
question.
but unclear in this case.
And also,
I think he's asking about burns
Yep,
on his
that's
chest. He's
very
showing him
good.
photos.
This is an endotracheal tube. That is correct. He was intubated, as I mentioned earlier.
They put a breathing tube down his throat.
No objection, Your Honor.
Is he trying to admit something into
You don't need to
evidence?
Publish that on the screen.
Looking at photos. There had been some testimony earlier about possible burns on the chest from the defibrillator.
Your Honor, I think that this should be exhibit number 65.
That's what Diane just said.
Oh, 65, okay. Because we had pre-marked 63 and 64. So the Commonwealth would move to admit 63 and 64 as,
Oh, okay. If they're pre-marked, they're already exhibits. In fact,
okay.
I took much of them this weekend. All right.
thank you very much.
Follow up, Ms. Blair?
Nothing further, Your Honor.
Okay, thank you very much for your time.
It's my pleasure. Thank you.
That's the end of the first witness.